Even before the Supreme Court overturned Roe v. Wade, Margaret Atwood's classic novel, The Handmaid's Tale, was already a potent symbol of America's regressive reproductive health care policies. Women often dressed up like handmaids and attended protests to demand abortion rights and equality, and Atwood's words became rallying cries and protest slogans. And as we continue to navigate post-Roe America under a second Trump administration, the book continues to offer stark warnings that are becoming more relevant by the day. In one scene from The Handmaid's Tale, the book's heroine, Offred, and another handmaid are walking home from the market when they pass by a public display of men who have been executed and hung on a wall. Quote, each has a placard hung around his neck to show why he has been executed, a drawing of a human fetus. They were doctors in the time before when such things were legal. They've been turned up now by searches through hospital records, or more likely, since most hospitals destroyed such records once it became clear what was going to happen, by informants. Ex-nurses, perhaps, or a pair of them, since evidence from a single woman is no longer admissible. These men, we've been told, are like war criminals. It's no excuse that what they did was legal at the time. Their crimes are retroactive. They have committed atrocities and must be made into examples for the rest. End quote. This is from The Handmaid's Tale. It was published in 1985. In the world of the book, the totalitarian theocratic state of Gilead, doctors had become the enemies. Their profession had been delegitimized. And as that scene that I just read to you suggests, there was no worse crime than to perform an abortion, an act so heinous that the state displayed their corpses to make public examples out of those doctors. In post-Roe America, doctors have become the targets of prosecution, too. And in the past week, a pair of stories have emerged that are chilling examples of how anti-abortion states are escalating their efforts to criminalize abortion and to punish those who provide it. Start in Indiana, where the anti-abortion group Voices for Life has been trying to get the state to publicly release individual abortion records, which include sensitive information like the patient's demographics, their zip code, and their medical history. Like many states, Indiana collects data on abortion procedures, but after the state implemented its near-total ban in August of 2023, there was such a steep drop in abortions performed in the state that health department officials stopped releasing individual reports because it feared that it would make it much easier to identify those patients. Instead, they moved to a system where they issued quarterly summaries of the data. But last year, Voices for Life sued the Indiana Department of Health to get them to resume putting those individual reports into the public record. The two parties settled that suit earlier this month, which paved the way for their release, with some redactions to those records. Now, in reaction to that, the executive director of Voices for Life said, quote, access to these reports will help ensure abortionists are being held accountable for violating health and safety regulations, end quote. But a pair of abortion providers have since filed suit to stop the publication of those records again. And they're now awaiting a judge's decision regarding whether or not the records can be blocked. Meanwhile, separately, in Louisiana, that state's attorney general is seeking the extradition of a New York doctor who prescribed abortion pills online to a Louisiana resident. Dr. Margaret Carpenter, a physician from upstate New York, was indicted last month by a grand jury in Louisiana, where the abortion pills mifepristone and misoprostol were recently reclassified as Scheduled 4 controlled substances. This is believed to be the first time that a doctor has been criminally charged for sending abortion medication across state lines. The New York governor, Kathy Hochul, has already rejected Louisiana's extradition request, but the case is likely to be an early test of so-called shield laws, which some states have to protect providers who prescribe and ship abortion pills to states where abortion is banned. Joining me now is Michelle Goodwin. She's a professor of constitutional law and global health policy at Georgetown Law. She's also the host of the podcast On the Issues with Michelle Goodwin. She's the award-winning author of the book Policing the Womb: Invisible Women and the Criminalization of Motherhood. Michelle, good to see you again. Thank you for being with us. Let's start with Indiana. This is a massive problem that has ripple effects across the country because everybody, not just people who have sought an abortion, but anybody with pregnancy complications, anybody who uses apps to track their basal temperature, everybody now has to think about what happens to records that can identify you as someone who may have been involved in an abortion.
Medical privacy has always been something that's been important in ethics and also in law. And you're right, this could affect any area of reproductive health care. But to what your audience should understand is that precedent matters. So then it's not just matters of reproductive health care. It's anybody who's had any kind of medical care that could potentially become outed by the government. What we express to our doctors, how we seek care, it's been very important that there's confidentiality, because without confidentiality, it is very difficult to get people the health care that they need. So this privacy, this ability to be able to speak frankly and honestly with the doctor helps a doctor to begin to understand how best to evaluate and treat a patient. But if patients fear that, not only will they withhold information, they may not seek medical care altogether. And given that we've just come through a pandemic, can you imagine what it means when people are sick, when they're unhealthy, and they fear seeking medical care, what that could mean to entire communities?
In addition, let's move to the Louisiana story. In addition to being held or criminally indicted in Louisiana, Dr. Carpenter from New York has been fined more than $100,000 in Texas, different state, for sending abortion pills to a resident in that state. Both cases appear to be preparing to challenge New York's SHIELD law. Can you just talk to us about these SHIELD laws? Because I got to imagine New York's not going to extradite this doctor. But is she free to go wherever she wants to go, or is she going to be worried that she rolls into some other state, they'll arrest her and send her to Louisiana?
Well, unfortunately, in this kind of climate, then she should be worried about stepping into red states. What these SHIELD laws have attempted to do, what they're looking to do, is to protect doctors who are acting ethically, legally, doing nothing different than their doctors would have done in those states before the Dobbs decision, which was in 2022, that undermined, gutted Roe v. Wade and reproductive privacy in this country federally. That means across all states. And so what we've had is this hostile, toxic environment in states where they have banned abortion, making it a threat to health, as you and I have talked about before. But it's not just a threat to health, it's a threat to medical providers being able to provide medical care to patients. And what these SHIELD laws do is to provide some form of safe cover for doctors who've been doing what they've been doing to help save people's lives. And I want to mention that in these cases, you have doctors who have helped minors. And that's how egregious this is. In the Indiana case, it is a doctor who helped a 10-year-old who had to escape from one state in order to get an abortion in another state, 10 years old, the victim of rape. In the Louisiana case, again, it's a minor that is involved. And that's an important thread that we should unweave, because even 5 years ago, or 5 years before the Dobbs decision, it would have been thought of as a bridge too far for Republicans to support platforms that denied reproductive health care for children who've experienced incest or rape. But here we are. And in Louisiana, there have been several hearings where there have been doctors that have presented cases where they said, look, I have a patient that was 8 years old and raped. You would force this 8-year-old to carry a pregnancy? And lawmakers there saying yes.
It's a remarkable set of stories. Unfortunately, we've got too many examples of what you're describing. Michelle, good to see you as always. Thank you. Michelle Goodwin is a professor of constitutional law and global health policy at Georgetown Law. She's the author of the important book, Policing the Womb, Invisible Women and the Criminalization of Motherhood.